Welcome to Visualize, the podcast where collaboration fuels change. I'm your host, Chris Baker, and each week we'll explore incredible connections between nonprofits, businesses, and the community. This is a space where we highlight inspiring partnerships, uncover strategies for creating meaningful impact, and share stories that show how working together can make all the difference. Whether you're a nonprofit leader, a business owner, or someone just passionate about building connections, this podcast is for you. Welcome back to Visualize. I'm Chris Baker, and today I have Dawn Liberta, and she is with Healthy Mothers, Healthy Babies here in Broward County. So, Dawn, tell us a little bit about yourself and how you got to the executive director of Healthy Mothers, Healthy Babies.
Well, first of all, thank you so much for having us. Having us as an organization.
Absolutely.
I'm so excited to be here and happy to talk about the organization. So, on a personal level, I'm married 25 years. I have two wonderful boys. I'm definitely a boy mom. And I was a soccer mom, but now they're adults, so 18 and 23.
Okay.
And then how I kind of got into this world of social service and kind of giving back is I was in school for my bachelor's degree for social work.
Okay.
And I interned with the Department of Children and Families in the foster care system. And I think really what pushed me that way was because my mom was abused as a child. And we know that in order to kind of move on with your own family, you have to break that cycle. And my mom she's passed away now, a huge inspiration of that, of breaking that cycle on how she was raised. So I worked in the foster care system with DCF and ChildNet for 25 years. And then I had an opportunity to come over to Healthy Mothers, Healthy Babies as their executive director. And I thought that would be amazing to work in the prevention part of social services instead of kind of the crisis area. All of that are important, but I just felt like I can make so many different changes in the prevention part.
I think when you start looking at ways to prevent something from happening, instead of just looking at it as like, oh, I'm treating the symptoms, but you're treating the root cause.
Right.
It makes a huge difference. And I think that's where we can all benefit. Mm-hmm. And I think a lot more organizations and, just the government as well needs to look at how do we fix the root problems, not just the symptoms.
Right. Not just like throwing everything at it and working on a crisis mode because it's stressful.
No, and it's not sustainable.
Right.
So, I really appreciate that. Mm-hmm. Awesome. So today I wanted to talk a little bit about, we met just over a year ago.
Yes.
And one of the things that I love is you guys have this amazing roundtable. So I would love you to talk a little bit about it because I've been there probably about 6 or 7 times now over the past year and a half. Yeah.
You're our favorite.
Really?
Yes. Absolutely. And every time you come, you bring something new. So it's amazing. And then you get to meet other amazing people and they get to meet you. So we have the Roundtable Luncheon. It's the second Thursday of every single month. Mm-hmm. And we bring people in from our community, all different walks of life and careers, where we're able to kind of sit down and talk to each other about what we do for our community and in our community. So absolutely, it's a great time for us to share kind of what Healthy Mothers, Healthy Babies does in Broward County. But it also is so helpful because we get to learn what they are doing in our community and how we can collaborate, how we can help each other make our community better.
And I love that. That's honestly so valuable, so valuable, because when we start looking at communication, communication and collaboration. That's the word I was trying to say there. Collaboration. You are literally changing the community around you because now you're opening it up and expanding it instead of just one view.
Right.
You have multiple views. And at the last luncheon or the roundtable that you guys had, I met the vice mayor of Lauderhill, and he was on our show.
He was. He told us all about it.
Yeah, I'm so glad that he was able to be here. So definitely go back and watch the previous episode of Ray Martin. That would be fantastic. He's got a great pieces of information if you have not seen the episode yet. And just to also talk about the way that the city can give money to nonprofits. That was this most valuable piece of that entire episode. I was just like, wow, this is perfect. So thank you again for that introduction. So that was a beautiful collaboration effort from both of us. So I would like to talk a little bit about what other collaboration opportunities or different ways that you have brought into Healthy Mothers and Healthy Babies, either from other nonprofits you're working with, the city, or for-profit businesses that are really kind of helping you make a huge difference.
Yeah, so Healthy Mothers, Healthy Babies really works. Our doors are only open because of the grants that we get and the donations from foundations, from government institutions, from cities. We have private donors. All of our services are free. So we could not do what we do without those people and those organizations. And so, for example, the city of Lauderhill, they give us money in order to help individuals in our community. Any individual. I know we're Healthy Mothers, Healthy Babies, but that is our one program that you don't have to be a woman or pregnant or have children. That if you need help with rent or your light bills, food, gas card, bus pass, any of those things, you can apply. And if you qualify and you live in Lauderhill with that funding, we will help you.
Oh, that's fantastic.
So we do have amazing folks like that. But we've luckily been able to really connect with not only our nonprofits, our corporations within our community and even outside of it. So we have great relationships with the Children's Service Council, with Healthy Start Coalition. We receive funding from Holman and the Jim Moran Foundation and A.D. Henderson and the United Way. So we are so lucky to be really surrounded by the community that we are. I mean, we're very lucky here in Broward County because we are extremely resourceful. And we know that it really does take a village to be able to help the families in our community, especially now, right? And we get together and we figure out how to solve those issues. And funders like that help us do what we're doing today.
So I know there's a lot of organizations here in Broward County. On a recent episode, we had Kathy Brown, and she mentioned there is 10,000 nonprofits registered in Broward County. That is a ton of nonprofits. Now, how are you able to connect with United Way, and how are that collaboration work? Because I'm sure there's other people out there don't even know how to even consider, having these conversations with these other nonprofits. And I know that that's a doorway that a lot of these smaller grassroots ones, they need an intro or figuring out how to approach it correctly.
They absolutely do. And, sadly, all the nonprofits, we work in the same way, and we work through those donations and fundraisers and grants. So sometimes we are kind of fighting for that same funding. I think that there's so many different websites that you could actually belong to that kind of help go through who has funding or grants that are coming available. For me, I think it's all about relationships. So it's so important that you're having those one-on-one conversations with other people in your community.
Sure.
Because at some point we're going to be able to help each other.
Right.
And so if I need help with something or one of my programs, or maybe I lose funding, then I'm going to reach out to those connections I have and those relationships just to see if there's anything that they have available at that time. Do they have a grant coming out? And if they do, then apply for those grants, or even reaching out to a donor. But really, I think it's all about connecting and all about the relationships that you have, and just really educating yourself on the community you're in.
Yeah, and a lot of organizations out there or businesses that are looking to try to collaborate with a nonprofit, sometimes they don't have the actual money or the funding to actually help. But what type of services or products that they might have in storage that could be very valuable for healthy mothers, healthy babies?
Absolutely. We have we will pretty much take any donations because we want to make sure that our families have what they need. So we have folks that may not be able to help financially, and that's okay. I completely understand. I wish I had the ability to help every nonprofit or organization that I truly believe in. We just don't. But people may have clothes for women or maternity clothes that are gently used that they'll bring in, or toys for children, baby clothes, formula that they no longer need, or diapers that they have left over. I mean, those are all things that our families really need. I mean, we work with families in those communities that aren't as resourceful and are underserved. And so we want to make sure they have everything and their children have everything, and that they're stable. And so any of that is amazing. The only thing we're unable really to take are car seats. Car seats actually do expire. And because they're used, we don't really know what's happened to them, and we don't want to put a baby in an unsafe situation.
100%, but I didn't
So
realize that car seats have an expiration date.
yes, and there's many that don't take used. There's a few here and there that I'll connect if people reach out, but
Interesting.
it's the only thing we don't take.
That's a very interesting piece of knowledge there. I didn't actually understand. Is it because it's actually gets clipped in and out? Is there like a manufacturer? Do you know anything more about that?
I don't know anymore. I could send you information on it.
It'd be interesting to.
But I mean,
Yeah.
it's a manufacturing expiration date.
Okay.
So I'll absolutely
Yeah,
send you some information.
I'll throw that in the link in the description as well, just so that if other people are listening and they're also curious, because now I'm curious.
I know. Listen, no one should feel bad about it. I have two children, and luckily they're adults now. But I had no idea that there were expiration dates on car seats when I was raising children. So
it's not something you normally would think about.
No.
That like, oh, yeah. But I guess, I mean, it makes sense.
Everything has an expiration date.
It does. So you mentioned a lot of clothing and diapers and a lot of other things that potentially, are perfect because, once you actually are pregnant and you've gone through it, you may not need those clothes right then. And someone else in the community could definitely use it. Kids grow up. They're out of their clothes quickly. And so, finding a amazing place to actually give them to, I think that's a fantastic way to look at other ways if they can't do financially.
Absolutely. Or even hygiene products. Cleaning products is a huge thing.
Baby wipes.
They're so cleaning products are really expensive. And so any of that stuff is amazing.
Okay. Yeah, no. I think that's anything that is not being utilized. Perfect. Okay.
I never thought I would get excited about cleaning products, but I mean, you don't realize.
Well, you don't know what somebody needs.
Really is like one of the top 3 things that we get requests for.
Really?
Yes.
So what are the top 3 things that you get requested for?
So we get, aside from the funding for this stuff, so diapers is typically number 1, and wipes, then hygiene products, and then cleaning products.
Oh, interesting. Okay, that's an interesting order. Okay, wonderful to know. The next kind of like topic that we love to bring up on the show is to talk about some of the challenges that you have either faced when working with other companies or other nonprofits and or the lessons that you have learned, because what we're trying to also do is have that conversation of, let's just make sure that we're all thinking outside the box and making sure that we're hearing what the nonprofit actually needs. So when we're asking the right questions and we can actually talk about it, we kind of prevent those mishaps or, challenges from actually happening.
Right. So we've been so lucky that we haven't really had any major issues with any of our foundations or organizations that have given us grants. I would say that some of the issues that I have, since I've only been with Healthy Mothers a little over a year now as their executive director, that I've seen is one that you do have, and I had mentioned it before, you do have quite a bit of nonprofits kind of fighting over some of that same funding, right? And not any one person deserves it any more than the other person. We're all trying to make our community better. So from a funder standpoint, it's a hard job, right? To go through those applications and try to figure out who's getting that funding. I would say the second thing is that it's important that for me going into it took me a couple of months to realize this. You would think someone wants to give you money, I'll take it. Give me the money, I'll take all the money. But there's such a big picture to taking money
Yep.
when it comes in, right? One, what are you doing with it? What program are you putting towards it? And if we take 10,000, but we need to see more clients, but it's not enough money to hire a new staff member, we're not going to be able to meet that goal, right? Because your staff, for the most part, are already at the top of their caseloads. And so you have to be careful that you're taking in and understanding what the funder is wanting from it, but what the organization needs from it.
It's interesting that you bring it up that way, because one of the most reoccurring topics that has come up on the show so far is the idea of overhead.
Yes.
And while like everyone's thinking of, okay, we need to put the money towards volunteer, the money needs to be going to these programs and you need to go here and just use volunteers. But who's managing the volunteers and who's handling all this, and how can we keep it consistent, and how do we do that if it's, a volunteer does, 14 different volunteers do the same thing because they can't be consistent? Is it always going to be the same? Is it going to help the organization grow? And so that's actually, I think, one of the biggest challenges right now that I'm foreseeing is a lot of people think that the overhead, because you're a nonprofit, shouldn't be there. But it's so valuable if you think about it. A nonprofit is a business.
It is.
It's just where the funds go is shifted from a for-profit. And in truth, overhead is like a normal part of for-profit businesses. We need to shift that. We need to pull it back into going, nonprofits are also businesses. They have employees. They have staff.
We have administrative costs.
There's administrative costs. There's all of this other extra overhead is what they put it under.
Yes.
And while, yes, you want to keep your numbers high to the programs, you can't keep them high unless you have the right team in place.
Right. And enough of the team, because it's not fair to the families or the staff. You want to make sure every family is getting exactly what they need from the program that they are in. And we can't do that if we don't have the right staff or the right amount of staff to be able to provide that service.
And you guys have a lot of different programs.
We do.
So why don't you talk a little bit about the programs, because I think it would be very valuable.
So we have 6 programs. We have our emergency basic needs, is what I mentioned earlier. We have our Forget Me Not support group, which is for families that have lost a child under the age of 1 year old. And it is a support group run and facilitated by someone that has also gone through the same kind of loss. And we have found that individuals going through this aren't necessarily ready for that grief counseling. But a support group of peers is very different. So you're in this group with other people that have gone or are going through the same thing you're going through. So it leads to that kind of extra support that is really needed.
It takes time to grieve and get to the point where you can actually do the inner work yourself. So having that support group is very important.
Absolutely. And it's okay. I have a staff member who lost their son to stillbirth 30 years ago. And she's still grieving that loss. And that's important, that it's okay to continue to grieve that. And you have the supports in the community to be able to help you.
And I know who we're talking about, and her story is so deep.
Yes.
And so emotional. And I'm so grateful that she's a part of Healthy Mother, Healthy
Me
Baby.
too.
Because honestly, there is so much love to, like you said, find a way to prevent it from happening to other people.
Because it shouldn't still be happening.
No. And
for the same reason 30 years later, we need to make sure we're making those improvements, which is exactly why we put the services in place. And that is to decrease maternal and infant death.
Yeah.
So we have a nutritionist and an exercise coach to help prevent and or stabilize if you have gestational diabetes or gestational hypertension. We have a doula. We provide medical education, parenting education, and we have a mental health program also that provides mental health counseling for depression, anxiety, postpartum depression, childhood trauma if needed. And we have a in-home home visiting program for child abuse prevention as well.
Yeah. So is that all of the programs? Are we missing one?
No, it's all of them, and I kind of combined everything that they did into one sentence.
My brain was like, wait, I think I only heard like 3 or 4. I thought there was 6, but no, you did just kind of like combine them together.
It's summarized.
So what does the future of Healthy Mothers, Healthy Babies look like right now strategically? Like, if you have any plans that you're trying to like put into the universe, like this is what we want to do, where does that look like right now?
So, yes, we have lots of plans. So right now, currently our goal is to strengthen and grow the programs that we currently have.
Okay.
So for instance, our Mahogany program, one of their goals is that every child on the case that is born within that program makes it to their first birthday. And over the last 4 to 5 years, we've had 0 infant deaths in that program. And it's amazing. And we just received an amazing grant from an organization that is actually worldwide. And they reached out to us. And of course, we put the proposal together and they offered funding. And so now we're able to expand that program. So now we're going to be able to take more cases on. And I'm able to put a therapist in place as well.
Oh, that's
so being that's one of the most needed services for our pregnant and postpartum women. Now I'll be able to provide that in 2 programs. So excited about that. So really our goal right now is being able to expand what we do have to be able to meet the needs of the community.
And there's so much need right now.
Yes.
Like I can definitely see, because there's still a lot of mothers out there that are not getting the nutrition, they're not getting the exercise that they need, they're not getting the education they need so that they can help prevent.
Right. And we're there also to be able to support them as part of those programs and be able to be with them if they need us to. So if they need our staff to be at a doctor's appointment so they could help advocate for them, then we will do that, because that is an important factor. We do know that the majority of maternal deaths and infant deaths are black and brown women and children, and that just shouldn't be the case. And so if we need to advocate, we will be there to advocate however they need us to do that.
Right.
And then looking to the future, one of my biggest goals is to be able to bring in like a fatherhood dad program into Healthy Mothers, Healthy Babies. So that's our goal within the next 3 years to be able to do that.
I think that's amazing because,
Mm-hmm.
you have all the support for the mothers.
Mm-hmm.
And don't get me wrong, they're the ones that are carrying the child and they're the ones that lost. But, there is the fathers that are also grieving. And so I'm loving the fact that you're trying to also look at ways to support them.
Yes. And, our Forget-Me-Not support group, dads can come. That's for grandparents, dads, moms, aunts, uncles, godparents, best friends. Because I think it's the whole family feels that loss when we have a loss of a baby. But yes, I mean, we need to support our dads in our community too. And we want to make sure that they're seen and they're heard and they're able to connect to their children. And so it's important to us that we're able to support that.
No, I'm glad to hear that. So the final question, actually, before I get to the final question, let's ask one more. How can people get a hold of you at Healthy Mothers, Healthy Babies?
So we take calls. We're open 9 to 5, Monday through Friday. And actually we have our phone that is accidentally forwarded to one of my staff. So she answers it almost 24/7.
Oh God.
And she even stepped out of a funeral to take the call on a Saturday. I'm like, I need you to not do that, because we need to take care of ourselves also, right?
Very important.
Self-care is important. So you could contact Healthy Mothers, Healthy Babies at 954-765-0550. And you can email me directly at dliberta, LIBERTA, at HMHB.org.
And the website is also
www.hmhbbroward.org.
So it is a Broward there. Okay.
Yes.
Yeah, good. Oh, I'm glad that I brought that up.
Can I tell you a little bit about our Mother's Day event?
Yes. Oh, yes, definitely.
So our Mother's Day event, it's our 32nd annual Mother's Day Luncheon, which is on April 29th, 2025. And it begins at 11 a.m., where we have amazing honorees from our community that we're honoring for being such amazing, not only parents, but humans in the community and making such a difference for the community that we live in. And so I would love for anybody to join us, and you can get that information on our website. And that again is www.hmhbbroward.org.
The last question that I love to ask everybody that's on the show: what is the legacy you personally want to leave for future generations?
That's a great question. I think what I want to leave Healthy Mothers and Healthy Babies with really is, one, being a good support to my staff, because I think it's important that if I'm there for them, then they enjoy their work and they do a better job at the work that they're doing. Having that support and hoping that I've been able to coach them and mentor them in the best way possible in meeting their needs. As for a community, I hope to be able to make some sort of difference in the maternal and infant mortality rate, really make a difference, and being able to educate our community on unsafe sleep, and really being able to have family understand that it can happen to any of us. So if we're co-sleeping with the baby, it doesn't matter who you are. This does not discriminate. This can happen to anybody. And it is so important that the baby has their own place to sleep. And so there's no risk
Right.
of unsafe sleep deaths. So, I hope to be able to make some sort of difference in the community, and the community being able to walk away, a little bit better, because I did whatever the job was that I was doing.
Awesome. Dawn, thank you so much for being on the show today. We really appreciate you coming on, so thank you.